we just exclude the maintenance treatments and we talk about the manner of giving these drugs, nobody's really debating platinum and taxane. So that's pretty simple. The question is, we had 3 randomized trials that all kind of came through, 104, 114, 172, that kind of really showed about 20-25% improvement in overall survival for patients with ovarian cancer. The uptake of that was not very good. Despite a big position statement, you know, most women still were not getting that, and so the majority were still kind of getting standard treatment, and there was very little uptake. The reasons for that is probably multifactorial. Probably a lot of women don't see people who do intraperitoneal chemotherapy. There was concerns about the toxicity, although that, if it delivered correctly, really is not a barrier. I think it's just inconvenient. Nobody wanted to admit them, and et cetera, et cetera. So some people have mitigated that through giving one-day chemotherapy. We have data to support giving carboplatin rather than cisplatin, which may be beneficial as far as terms of tolerance. So that the barriers to it are probably more than just people's belief in it. And I think people are ready to believe that it doesn't work. But if we really look at the data that I was talking about tonight, we have those trials that compared to standard chemotherapy showed the benefit, but suddenly we had, you know, this 252 trial that came out, and everybody thought about it as an IP. So, that kills IP, but really that was like a dose-dense chemotherapy versus IP chemotherapy in the setting of giving Bev. So if you give Bev, it seems to erase the effects. Does that mean that IP chemotherapy did worse and all of a sudden IV did better? Who knows? Because we don't know that answer. My guess is that kind of like 262, when you give bevacizumab in the addition of chemotherapy, where we saw dose-dense doing better than every 3 week, at least in the small 15% of the patients who got that, when you added the Bev, it just didn't make a difference.